So patients with Lewy body disease have three clinical core features, including visual hallucinations, which include the little people and seeing furry animals, REM behavioral sleep disorder, where they act out dreams at night, and it can often get pretty violent to either a bed partner or to themselves because they're kicking, punching, fall out of bed, and have no idea it's happening. And their dreams seem very, very vivid. And that's because in REM sleep, usually, if everything's working correctly, your whole musculoskeletal system is paralyzed, or there's atonia, so that you don't sleepwalk or act out your dreams. But in patients with dementia with Lewy bodies, the Lewy bodies, which we'll talk about, build up and they don't allow the muscles to be paralyzed, and so they act out dreams. And then lastly, the most important feature of patients with dementia with Lewy body is that they have Parkinsonism. What that means is that they look like they have Parkinson's disease, which has a whole bunch of features, but they also have the REM behavioral sleep disorder and visual hallucinations. So instead, it's called dementia with Lewy bodies with Parkinsonism. A little different than Parkinson's disease, but a sister disease and pretty similar. The other main point is that they have what we call cognitive fluctuations. So basically, they'll have these periods where they just look like they are totally spaced out, and it's called a behavioral arrest. So they'll be talking to you, and all of a sudden, just stop talking and stare away. And you put a hand in front of them, and you kind of shake them, and they're just frozen in time. It can last seconds, all the way up to days, where you're really worried they're paralyzed or they're having a stroke, and then all of a sudden they snap out of it. It's very frightening, and it's really hard to tell what's going on. In its most extreme phases, it can last for days, but most likely it usually lasts a few seconds, and then it kind of they come back to normal. So let's go through the core features again. So most of them have visual hallucinations, where you see these well-formed furry animals or little people. You can also, though, see colors and abstract shapes. And then you can also have complex hallucinations where you maybe see a dead loved one and you're having full-on conversations with them. And then your family member tells you, oh no, they died a long time ago. That happens a lot to patients, and it's really frightening for them and pretty scary, unfortunately. Two-thirds of patients with dementia with Lewy bodies have these visual hallucinations. In addition, we have the REM sleep behavioral disorder. This is in 85% of patients, and it happens really early on in disease. So I often ask a lot of my patients about REM sleep behavioral disorder because it kind of clinches the diagnosis of DLB. So you basically act out your dreams in REM cycle, and the movements last less than 60 seconds, but can really injure someone. And then 90% of patients have Parkinsonism. So it looks like Parkinson's disease, but it's a little bit more extreme because they also have the REM sleep behavior and the visual hallucinations. What happens is you develop rigidity, which means that your muscles get really, really stiff and you can't relax. You get something called bradykinesia, where your muscles move very slowly. And you can also have that tremor that a lot of patients with Parkinson's have, but in patients with DLB, you don't have that tremor as much as regular Parkinson's, and that's what can help you differentiate if someone has regular Parkinson's or this condition called dementia with Lewy bodies. One important factor is that you should never give these patients antipsychotic medications. Antipsychotic medications are used rampantly. I would use them in Alzheimer's patients, especially if they're having behavioral outbursts or they're having hallucinations. I give them to them a lot. But the problem is that in dementia with Lewy bodies, the antipsychotics can actually be really harmful and in some cases fatal and kill patients. So that's why it's really important that when you have a patient with dementia, to really figure out if they have dementia with Lewy body versus Alzheimer's or something else, if you can, because this is the one time where you cannot give them any medication and antipsychotics can kill them. So what are these Lewy bodies? Well, it's called dementia with Lewy bodies because it's this abnormal protein aggregate in the brain that builds up. It's kind of like a dark pink with this halo around it, and it's called a Lewy body. And we find these building up throughout the brain in patients with DLB. I just want to go back to this point of antipsychotics. So in patients with dementia with Lewy body, basically what happens is they have a lack of dopamine. Dopamine is a neurotransmitter that's really important in movement of patients. So because there's a lack of dopamine, they get this Parkinsonism where they have rigidity, their muscles don't move well, and they look like they're frozen. So if you have a lack of dopamine already, antipsychotics work in that they block dopamine even more. because usually when dopamine is running rampant, you get hallucinations. And so, in patients who already have low dopamine, and then you block their dopamine even more, it can cause them to die because then they become so rigid and stiff that it's actually harmful. So, we've really talked a lot about different flavors of dementia, and I just want to reiterate a final couple of thoughts. As you've learned throughout today's talk, dementia is more of an umbrella term, and it doesn't just mean memory loss, and it doesn't just mean Alzheimer's, because as I've demonstrated, even within Alzheimer's, which is the most common form of dementia, you can have executive functioning, visuospatial problems, not just memory problems, and later on psychiatric and language issues. And then moving on, if you talk about frontotemporal disease, you really don't even have memory problems, but it's more language and behavioral that's affected. But it is still in a dementia because it affects a cognitive domain. Minimal treatments exist for all the different dementias we talked about, but really figuring out how to keep patients safe, busy, and socially interactive and exercising is the most important thing we can do. And then cognitive domains are affected differently, giving each dementia disorder a different flavor. Thank you so much for your attention today, and I hope you learned a little bit about neurology. Thank you so much for your time, and I hope everyone's staying safe and healthy. Take care.